skill that we're going to be doing now is a physical assessment. Physical assessment is something that you're going to do on your patients, whether you're in acute care, long-term care, the clinic setting, just be different variations. What we're going to do for this scenario is that this is a patient on a surgical floor, so we're going to be doing complete head-to-toe physical assessment that's required every 8 hours on our patient. So I've come into the room, knocked, I've told him what, Mr. Anderson, what we're going to be doing. I've checked his name band to make sure that I've got the right patient, and he's repeated his name and birth date back to me. So I've got the right person. One thing I might do first of all is just take an overall look at him and kind of focusing in on his face for part of the neuro. I'm looking for symmetry. Symmetry of his eyes, of his mouth. He might be talking. Is the speech slurred? Is the contour of his mouth, is it equal? Is there any drooping? Can he blink both eyes? Different things like that with the head. Also with the neurological assessment, I'm going to be checking orientation. I'll be asking him some questions about the date, the time, who he is, where he is, items like that, to see if he is completely orientated to person, place, and time. Another thing I'll have him do is that I'll have him grab onto my fingers, and I'll at the same time have him grasp onto my fingers and have him squeeze. I like to do it at the same time, both extremities, so I can see, are they equally, bilaterally. Some facilities will have you grade it from 1 to 4 on the strength. Another type of strengthening check that you can do, and I'm not going to expose my patient here, but at the foot of the bed, you would put the palms of your hands on their feet and tell them to push. Then you'd go with your hands on the outside of the feet and tell them to pull. And there again, you're looking for the strength bilaterally to see if there's any difference, to see if they're weaker on the left side or on the right side. I will see if they obey commands. I'll say, Mr. Anderson, can you touch your nose with your left finger? And we'll see if he follows the command. Or lift your right leg, or turn your left ankle. Something, just so that they understand the commands that I'm saying. Another thing is sensation. Are you having any numbness, any tingling? Can you feel this? I might want to, just pinch, not pinch hard, but pinch a little bit on their fingers or on their toes. Can you feel the sensation? All that's part of the neurological assessment. One other important part is that now I want to check the eyes. I would go ahead and dim the room a little bit if it's possible. I'm going to have him look straight ahead or just straight at me. I'm going to get my pen light. Remember, the lights are dimmed. And I'm going to come in from the side. And what I'm doing now is looking at the one eye. Did it constrict? Good. Now I'm going to come in again. I'm going to look at this eye. Did it constrict? Yes, it did. Now I'm going to come over here. The same thing. Come in on the side, and I'm looking at this eye. See if it constricted. And then I'm going to come in again and look. Did it constrict? That's a consensual response. If they're both doing it, you want them to constrict, not dilate. And you want them to be equal. Sometimes you can have a gauge to see how many millimeters they are in size. That'd be pupils equal round, so I'm going to look at them. Reactive to light, I just did that. And accommodation. Go ahead, Mr. Anderson, and take a look at my pen light and follow it with your eyes. I want to make sure the eyes would go a little bit almost cross-eyed and then go back. Cardinal signs, you can go ahead, take a look at my pen light. Don't move your head, but follow my pen. And you go ahead and do 6 of them. And see if he can follow them with his eyes. That would pretty much conclude their neurological assessment. Next thing I'm going to go down to is the heart assessment. I need my stethoscope for the heart assessment. I'm going to be listening to the heart tones, but that's just part of your cardiac assessment. The first is your S1 and your S2. Your S1 is with your mitral valve and your tricuspid valve. They're closing. So you're wanting to make sure that there's no swishing sounds. That would be like a murmur. Or if there's any extra sounds, that would be like a gallop. You just want a lub, dub, lub, dub. That's what you're looking for. And if it's anything else, you would just note. Don't worry about diagnosing. Just chart what you hear. So the S1 is the mitral and the tricuspid closing. It's on the 5th intercostal space. So you would just feel down on him, 5 spaces, and it's mid-clavicular. We know here is our clavicle, so in the middle of the clavicle. So it basically goes right below the breast is where you're going to be listening for S1. So I would go ahead and put my stethoscope, and I would listen for a full minute. This would be my apical pulse. And I'd listen for a minute. And what I'm listening to is to see, is it regular? Is it irregular? Are there any skipped beats? Once again, was there any swooshing? Any of the sort. The other is your S2. Your S2 is on the second intercostal space, just to the right of the sternum. So your sternum is here, it's just to the right. So I'll do the same. Listen for a minute and listen for any abnormal sounds. That's your objective portion. Your subjective is that you would ask him, are you having any chest pain? Do you feel faint when you're walking? Do you have any palpitations? You have to ask them some questions too. Another good thing to do for the cardiac assessment is to check their pulses. Start with the temporal, the carotid, the brachial, radial. You get my drift. Going down to the end, one thing you've got to make sure that you do is to check their pedal pulses. Pedal pulses, there is the dorsalis pedis, which is right on the top of the foot. I know it's hard to see here. Dorsalis pedis is on the top, and on the inside of the foot would be your posterior tib. So make sure that you know where these are. And again, you're feeling the pulses to see how strong they are, and you're checking for edema also. This is part of the cardiac assessment. You could check the popliteal pulse as you're going up, femoral pulse. Know your pulses, what they're called, and where they're located. And this would conclude the first portion of the physical assessment.